especially when we're looking at the healthcare side, we've looked at some of the things that have to do with the impact on the patients and how we can change that more dynamically to make it better. We have a new lot down at Hillcrest that was supposed to be online in December, which we hope to have online soon, that is a pay-on-exit kind of system so that the patients are less impacted by not knowing how soon they need to come back to the parking and what's available. So we're really trying to look at methods of being able to improve how we provide the services. So we are going to try and record this stuff. Did you have your deal up there? And
there was some
went down, yeah.
problem.
So what we're trying to do is record the process so that it can go out on the web. The last town hall meetings that we did are available on the web. We do have a website that's available so you can see what's going on. When we originally proposed things, we proposed them for a July date. July date is because that's when the fiscal year changes, and we're trying to do an alignment with that and make things kind of aligned with that time frame. So we've had some issues over here. If you see him playing around down there, it's because there were sparks that flew out of there a minute ago, kind of killed the PowerPoint that we had going up. But what I really would like to do is find out feedback from you guys on concerns or questions that you guys have. So just to give you an example, we're looking at about a $2.1 million deficit this year. Part of that, we have a very successful bus zone, which is inappropriately called a free bus zone. It's actually a subsidized bus zone. This year it'll cost us $3 million a year. Originally it was $300,000 a year, but its popularity grew so much that it's become one of the main transportation areas. That is $1.16 every time somebody gets on the bus. Last year it was about 2.5 million riders, and that's continuing to grow. That is a real good sustainability effort for the campus, but it's not sustainable from the aspect that it's being funded out of the people who are paying for parking and citations. What we want to be able to do is get the campus to buy into the fact that this is a great sustainability issue. It does relieve traffic in the campus. It relieves pressure from the campus around the surrounding community on the transportation, but it's not something that should be borne just on one group. It should be spread across the campus, either as a campus initiative tied into sustainability or other ways of making that happen. So that free bus zone that has been out there has some real issues with being able to provide it in a sustainable fashion. We do have the shuttles that we provide. We want to make sure that we can continue to provide the ones that connect campus to campus point. We've been talking about some ways to increase our access in and across campus. We have the Hillcrest shuttle that runs back and forth and services the two campuses. We're looking at some new shuttles for that to kind of improve that service and get a little bit bigger shuttles and more reliable shuttles to service that area too. So I can talk about all kinds of different aspects, but I kind of want to be able to get some feedback from you guys. You came here, you had some obvious reasons why you wanted to come here. So any questions or ideas or thoughts that you want to share? And we can kind of start there.
I have a question.
Yes.
If you get the bus zone, the transit pass, are you allotted any the parking on campus where you just once in a while use it?
The occasional use permits?
Yes. Do you get any days with the transit pass?
I don't think that was part of the proposal. One of the issues we have with the OU permits right now, kind of twofold issues with the OU permits. They're a paper permit that we've had a lot of fraudulent use on. So people have taken and they're not supposed to be marking in pencil. They mark it in pencil and then they erase it and keep moving the dates around. Or they use black tape to mark it off and then peel the tape off. So we're trying to get away from using those permits at all and going to codes, because with the codes then we can track how many times people have used them, and we can also make them so they don't expire. So in the past the OU permits were a rollover type permit. We're going to continue that process until we can get something else in place, but that rollover meant that you had to come back to the office and change it out. So it was kind of a burden on you and it was another cost on us. So we're trying to clean up that process and make it more streamlined as well. We hadn't really talked about something to do with that. If we can get it to where people are actually buying the buying the transit passes, we're still subsidizing that transit pass. And so that cost is already a part of the program. The more we drive people to using the alternative transportation programs, the better it is for the campus, but it doesn't generate funds for us to be able to support that.
Okay. And is that something that can be done through auto deduction, payroll deduction?
Yeah.
So that you don't have to keep going someplace and renewing it.
That's what we're,
Transit pass.
right, that's what we're working on. We're working on two pieces of that. One is we're trying to turn the ID card into a transit pass, and we've been working with the ID card office, and they've got the chip technology there. Now we're working with Sandag to make sure we can get them to buy off on it, because once it's in the card, then you reduce the number of things that you have to carry, right? You don't have to carry a Compass card and your ID card. You have the one card. Trying to get the campus into the thought process that you don't need to have all these different cards. They can all be in one technology, and then we don't have to have, I carry 3 cards with me right now, actually 4 cards with me right now, and that doesn't have to happen. The campus I came from, we incorporated everything into a one card. So getting people to see that we can use the transit pass for that, we can start maybe moving some other things to that one card concept too and reduce the number of cards. That said, that technology being tied in, we're also working on the back of the house to tie it in so we can do things like payroll deduction for the transit passes. And in doing that, we may be able to get some tax benefit for the individuals.
We actually already do offer for the Compass card. We don't have the one card system yet, but we do have a separate electronic transit pass available. And if you're a UCSD paid employee, then you can do that currently on payroll deduction. And it is on a automatic recurring basis, and you do get the pre-tax benefit.
Oh, okay, great.
So we are trying to make it so that we can incorporate any tax incentives with that we can. So, okay. Other questions?
This is Q&A already?
Well, we really want to make it be an information exchange. We're not really into just doing a presentation. We're into being more of a feedback loop.
Okay.
So.
I was at the Move On UC San Diego site.
Uh-huh.
I think I read that the campus shuttle will remain free. I believe that's what I read.
The on-campus shuttles, yes.
There's a subheading regarding phasing out the city shuttle over the Superloop, right?
The Ariba Nobel shuttles,
Right.
or the city shuttles, yes.
That sort of implies that was like a subheading to the campus shuttle, that what you foresee happening is you still will subsidize the Superloop then?
Even when we're looking at doing the transit passes, all of our program was scheduled so that we would have some subsidy to offset the cost. We're going to start with a 50% subsidy in the proposal and move to where we have a continuous 20% subsidy of that program. Okay. The City Loop right now, what we're trying to do is look at what really fits the campus, right? And when we talk about shuttles, the shuttles should be serving campus points. So Hillcrest to the main campus is a campus point. Main campus down to SIO is a campus point. Main campus out into the community is not a campus point. And what we've had is some real issues with liability. We've had several accidents out in the community where the vehicles have actually collided with other vehicles. We had one incident where we had somebody that actually got hit by one of our buses. And so we're trying to look at how we can pull those loops out of the community and put them back onto campus so that we're not, as a campus community, increasing the liability of the campus around us or the community surrounding the campus, and also reducing the traffic that we provide on that area outside of campus.
Okay. But you still foresee the worst case scenario is still the Superloop will probably be a fee service, right?
What we're working with the campus on right now is telling them that the quote-unquote free bus zone that we have right now is, one, not free. It's a subsidized service that's subsidized entirely by transportation services, and that it's a great sustainability effort for the campus, and it really helps mitigate the traffic that we have around campus. But it's not something that should be borne on one department. It's a great sustainability initiative, and the campus wants to talk about sustainability. So how do we fund that from the campus-wide perspective? Now, before I came here, the group that was empowered to look at the different scenarios was really told to focus on how transportation services can continue to provide all these services, right? What I've said is, let's kind of pull down those barriers a little bit more and say, if this is a core purpose for the campus, then shouldn't the campus be involved in that core purpose? And sustainability is a big campus initiative. We want to make sure we can maintain those traffic patterns as far as people going and using the public transportation, but we can't fund it the way that it's done right now, right? So we were talking a few minutes ago about it being a $3 million cost this year alone for the current system, and we're losing $2.1 million a year. So if we had some other form of paying for that, then we wouldn't be talking about some of the other issues that we have for transportation, because that piece would then be supported, and then we could look at really advancing some of the technology we have on campus, right? So when I talk about advancing some of the technology, we're looking at a lot of different things, and one of which is kind of tying it into some mobile apps. So if you're driving campus, you could actually see where the preferred parking is going to be for you. You're going to plug in a location, destination. It's going to tell you if that lot's full, or if it's near full, or if there's closer parking that's available. Those are the kind of technologies we're trying to look at to make it easier for the people that do drive to campus. We've been talking with the campus about taking the bike policy, the bike study that was done, and dusting it off and saying, okay, you know, we didn't have the money to fund this entirely, but what pieces could we start? So we could actually start looking at how we can use some alternative methods of transportation to support the campus network. So we're really kind of trying to say, we need to look at transportation holistically. It's not just parking, it's not just buses, it's how people come to campus in all the different manners that they do, whether it's here or Hillcrest or any of the other facilities that we have, and making sure that we look at it so that we can support the lessened traffic coming to campus from the vehicular traffic, and support long-term how we can make those other operations work. And currently, it's just that financial piece isn't sustainable the way it's set up right now.
Okay. Has TVS considered like a three-tier fee system? One for Superloop only, one for like the sticker zone, and the third one I think you proposed was to just go for the full-blown MTS pass, which is $72 a month. I think you probably won't encounter such a big backlash if you provide like a la carte type fee system, because I'm sure majority of the students, staff, and faculty do not really need a full-blown MTS pass. I think majority of the ridership are probably within the UCSD region. And I'm sure for the students, it's probably only at the Superloop.
We can certainly go back and talk to it, and that's one of the reasons why we're trying to get feedback from people, is because when they come up with ideas like that, then we can explore them. One of the things that the students have been working on, and they're not going to get to it this year, they were working on an initiative where they'd have what's called a U-Pass, which is kind of a universal pass for the students, supported by a student fee. Now, we don't want to be seen as the drivers of that. We want to make sure that we're there to support them, but we want to make sure that we kind of step back from it so that it's a student-driven initiative. Because if it's seen as coming from us, then it's something we're imposing, and we're not trying to do that. That's why we're looking at the other components and what we proposed, but we're also working with the students on how they can get to that piece. Currently, what they're looking at with the return to aid component, which is 29% of whatever they raise, is kind of beyond what they feel they can support. So we're trying to say, okay, I understand where you're at. If we look at what we were offering to support the other piece of transportation, how could we help mitigate that cost and make it so that it might be more sustainable? But we need to put a few pieces in place before we can actually make that as a proposal to them and make sure that they're ready to move forward on that piece. Because if that piece goes in place, there might be the ability for a staff and faculty permit to mimic that in some fashion. And that would be something we'd have to negotiate with MTS, and then that might be something that the campus can support too. The broader support.
Yeah, and there's two components to that question. It's tricky. It sounds very good in theory. Well, the first one is the bus on sticker that you talked for the blue and white shuttles. Well, we cannot be a transit agency. We've been tasked to explore the option of charging, but I know that Todd, if we were to charge for people to ride the buses, then we would be a transit agency, and the requirements, the legal requirements to be that entity would be different than just training and provide a certain number of hours a year to students to drive. So that would increase the cost, and it can be a double sword.
So what he's talking about on that is for the shuttles themselves and not for the MTS, because we're not public transportation, and we've had this discussion with MTS where MTS seems to think we should be providing certain services, but because we are not a transportation agency and we're not licensed that way, we don't have the capacity or the buses set up to do that. We don't have the federal inspections and the state inspections to do that. We could shift and do that, If we shift that direction and start charging and looking at doing that model, then my response back to MTS is, why don't I go back to Sandag and ask for some of the money that they're getting for providing that service too? So we are not adverse to looking beyond that, but we want to be good community players too and not play hardball if we don't have to. So.
In addition, we have talked to MTS about a limited bus cost service. So much of the service that's used by UCSD affiliates is within the existing bus zone that it is just a minor incremental savings. So for very little percentage more, you get access to the whole region. And because we're looking at a subsidized rate anyway, there really is no major benefit to people to save a couple bucks a month to not get access to the whole service and to set up a whole parallel program.
Yeah, but you're talking about the worst case scenario is when you stop subsidizing it, $72 a month, right?
Well, the current plan is to stop subsidizing completely, so.
And the current transit pass is $72 a month.
Correct, but we also have some leverage with them, and we're looking at options of purchasing what they call an echo pass. So if we agree up front to purchase a certain number of passes during the year, we can drive that price down about 25%. So we are looking at ways to reduce the cost to the end user in as many ways as possible.
Yeah.
And that would be for a full regional pass.
Yep.
That sort of answered my question. If we buy in bulk, I mean, they're already only charging you $1.16 per ride, which is half the price of the bus rides to begin with.
Yeah.
They should be subsidizing us for buying in bulk. And if we can get 25% off of that fee or more, then there's no reason for the people who have to park on campus to need to subsidize that 25%. Let MTS subsidize that 25% and don't increase the prices for those of us who have no choice but to drive to campus.
Right.
I don't feel like I should have to pay for people to get to ride the bus for free or for even discounted because they're lucky enough to be able to live someplace where they can ride the bus. I live in Santee. I have to drop my daughter off at school. I have to pick her up from school. I have no choice.
Right.
I can't take public transportation. It takes an hour and a half.
And
to
even
get from Santee to here.
even if you live some places that are close, still those routes on the public transportation can take an hour and a half just to get here. I live in a place that is close to campus and there is no public transportation, so there's no opportunity even available. So stabilizing the long-term cost of parking is one of the things that we've been talking about as well. I know that the proposal talks about the increases and the ongoing increases. We need to be able to get the costs under control so that we don't have to look at those increases. And what you're talking about is the subsidies for the other programs and the impact that it has. Part of that is kind of driven by UCOP in what we're supposed to be doing. But part of it is the campus culture of what's been allowed to happen over the years. So we need to be able to look at it from that bigger picture of, if this is a good thing for UCSD, why is one group paying for everybody to do it? And spread the wealth out across everyone. Make it more accessible, but make it something that is campus supported and not department deported. Supported, not deported.
That's the key point. So the system is self-supporting. It's only funded by the permit fees and citations. That's the only
Which is
support.
entirely wrong.
I would agree.
That's the point, yeah.
Entirely wrong.
So that's what there is to work with now. If there's some changes maybe in policy or saying, look, this is a campus-wide resource, maybe there should be some other,
Well, the people who are using it need to pay for it.
Right.
If
So
you're riding the bus, you need to pay for the bus. Arrange a discounted fee, but don't make me pay for you to ride the bus.
Right. So some of the things we've been looking at too, and we've had other people that have been engaged in some of our town hall meetings that have said, I think I know a source for getting some grant funding for this. So we've been trying to go down those roads too, because anything that we can do to provide that subsidy and remove it from the support of the people who are parking is a good thing. Now, we have excess capacity of parking on campus, even though a lot of people feel that we don't have enough capacity. We need to make sure that people understand that what we have for capacity on parking is adequate for several years, but it may not be where people want to park. And so we have a lot of people that are concerned that we have too much A spaces in some areas or not enough student spaces in other areas, or the B spaces. The one I get calls on all the time is Gilman parking structure, right? The B spaces are full by 8:30 in the morning. Well, that doesn't mean B spaces on campus are full by 8:30 in the morning. It means those in that location are. So trying to provide some of the technology to help people know where the parking is will help control some of that angst about parking. And in the long term, what we're hoping is that it'll provide a better tool for how we look at parking, and it'll make it so we won't need to add more parking, because adding parking is expensive. We don't really have any identified spots for adding surface lots. It's all parking structures, and parking structures are where the cost comes in. I was talking to somebody on Thursday. They were proposing a new parking structure on campus. They said, we've got this guy, he comes in, he says we can do it for $13,000 a spot. I said, that doesn't sound right. I said, okay, where's the number coming from, and how's that comparative to anything else? And he said, well, when we throw in all campus costs, it comes in at $19,000 a spot. I said, that still seems really low to me, because the last one that was built was Thornton, and it came in about $27,000 a spot. Now, my experience is that campus building structures on campuses runs anywhere from $30,000 to $60,000 a spot. So if we have to build parking structures, then we've got to be able to finance them. And that's really the people who are buying the permits. That's what they should be paying for. But if we can mitigate some of that and make it so that we don't need to build the parking, then we don't have that added cost. That's part of where the concept of trying to use alternative transportation can actually offset the increase in future costs. What we want to do is mitigate those future costs so that we don't have to look at continuous increases, because I think our parking costs are significantly high enough right now, because it's a burden on the people who have to use the service. Now, that said, if we can control things and make sure that we're putting the money in the right places to support those, then we should be able to control those costs in the future and not have to look at those increases. What they were given for tools when they were putting all this together was, how do we come up with this model to pay for everything that everybody's already getting? And what we really need to be able to say is, should we be paying for everything that everybody's getting? And then start breaking it down from there. That wasn't the tool that they were given when they were asked to do this. They were given the tool to say, find out what everybody wants and then make it fit, right? So they did a great job in putting this together. All these pieces that were here came in before I came in. I'm supportive of the efforts that they did. I understand that when it went out, it's kind of that shock factor, right? But that's kind of the way we got people talking too. And I think that this is not reminiscent of what we've seen already. We've seen more people come to a lot of the town halls that we've done, because there's been a little bit of time since this went out. The kind of shock has worn off a little bit, but we really need to have the feedback from people. And health sciences on campus is a little bit different group than the main campus part, and we want to make sure that we're pulling in your guys' view before we go to the next phase of being able to put out the next proposal. So a little shock and awe, but really what we're trying to do is get people to give us feedback on what they see as being fair and able to move forward. There's going to have to be changes. They're not all going to be easy, but we want to try and make them as balanced as possible. So I hope that answered your question.
Yeah, well, but back to we don't have a parking problem, we have a location problem.
Yeah.
Here, I come from Santee, I have to drop my daughter off at school. I get here close to 9 o'clock, which is when I'm supposed to be at work.
Yep.
If I work on campus, I work over in School of Medicine. If I have to park by Perlman because all the other spots are full, it takes me another 20 minutes by the time I wait for a shuttle or choose to walk to get to work. Then I have to leave work 20 minutes early to get back to my car by 5, because it's going to take me an hour to get home. So if we have a location issue, then we have to figure out how to get people from those locations to where they actually need to be.
Right.
Faster.
I would agree.
Because I can't lose 45 minutes of work time just to commute to from my car.
Yeah.
If I can't park in the pit parking lot, then I have a big issue.
I won't blame anybody for the pit parking lot situation. Now, one of the biggest problems we have on campus, right, is construction. it's a blessing and it's a curse, right? So they're building in the pit area, and all of our parking lots are identified, all of parking lots, not the parking structures, are identified as building spots. So anytime there's building, they tend to put it in areas that already have a high density. And the problem that we've seen is that they don't plan on what the parking demand is for that, right? So you add a new building, you're not just adding to the parking need for the area, you're also taking away the current parking spaces. So it's a double whammy for us. So what you're talking about is not just the impact on having that pit parking area going away, 50% of it's gone right now, but also how do we make sure we meet that demand for the traffic flow that needs to happen? And that's really where Todd over the years has been kind of trying to work at looking at how our campus loops work. And we've had some systems in place that we've tried to do it. We're looking at some newer updated systems. We were just up visiting with the people at Sanford, and they have a new program that they're putting in place. If we can tie into that, it gives us some more real-time data that helps us shift those patterns a little bit. We've also been talking about, instead of using buses for on-campus shuttles, going to trams. Because sometimes the issue is, if you're using buses, you have a pinch point of that door for everybody coming on and off. But a tram, actually you can get everybody on and off in a much quicker fashion, right? But we can also add cars as we go. So if we know that's a high demand time of day, we add more cars. Now we can carry 90 people instead of 45, right? So we can increase capacity and better increase the flow and actually increase our ability to pick up people in a timely fashion, because we don't have that amount of time it takes to add people to the shuttle or take people off the shuttle. So we're looking at a lot of those different things. The other is, this is just kind of one of my pet peeves, the campus has very poor wayfinding points, so that to walk from one place on campus to another, many people don't know how much time it takes. So what they're doing is they're walking from here, and they need to get here. They're walking out to here to take a shuttle that goes around the campus to drop them off over here so they can walk here. And if we had better wayfinding, we could help people get more directly to that point, and they'd know what that walking distance is. You actually knew the walking distance between the 2 points, and I applaud you for that, because many people don't. Yeah. And I've walked the campus. I come from Alaska, right? So half the time it's winter, more than half the time it's winter. Snow, it's still snowing up there right now. And people walk the campus, and it's a big campus. It's an uphill campus, big stratosphere between one side and the other. You really are looking at people can ride a shuttle to get around campus up there and choose to walk because they know the paths, they know the directions to get there, and they know they can do it sooner. And they do it even at 40 below. We don't have that kind of weather here, so we don't have that impediment that should stop people from choosing the healthier option of walking. But they don't know how long it's going to take them, and I think that's the bigger challenge. We have people on the side of campus where the new housing structure is that'll wait for 2 shuttles rather than walk the distance, because they don't know that it's actually quicker to walk than it is to wait for that shuttle. And the health implications of taking that walk is so much better anyway. So,
Robert,
yeah.
Is there, because there has been such an impact in parking in health science area, I don't necessarily think, I think it's a time constraint for you and many others that work over there. Has there been any thought, or is there a shuttle, because they're getting pushed out to the Regents area to park, any thought, or is there a shuttle that connects the Regents area to health sciences?
Good question. She's not a plant, she's one of our staff. So, Todd?
So the one good thing that's going to come up, and it's going to take a little bit of time with Robert, our good friend here for planning, is the Gilman Bridge when they do build that.
Yeah, I was gonna ask
That-
That's
I mean,
been,
that's
like, I
gonna
was a
change.
student here. I
Right.
graduated from here 25 years ago, and that was planned then.
Was the trolley planned then too?
I don't
Yeah.
remember if that was planned. But the bridge from Thornton area to the VA hospital.
But once that's in, then we're looking at, being able to take the campus loop as it is now and just extending that to go out and around. So it would connect that, both sides. Right now we have the Sanford shuttle running, and we're still tweaking that back and forth. I mean, there's no reason we can't possibly run that back through campus runs every half hour, so it's not consistent. That's also partially funded by Sanford School of Medicine and us, so that one's split 3 ways. You can catch the Med Center shuttle, which is every half hour. You know, you can catch that out there to come back across as well. It's tricky, to say the least.
I have some different visions for things than other people have, right? So my daughter spent a year in Spain, and when she was there, they had outdoor walkways that were like you have in airports that move people mover type walkways. Our environment here is as good or better than Spain, so maybe we need to look at some different technologies for things that we do. You know, the cost of doing that, one, it's electric, right? So there's an electric cost, but there's a CO reduction. And so we're helping our greenhouse gas emissions. And we can encourage people to use those internal paths. Identifying those internal paths better is one way. So you're talking about where you're parking now as opposed to being able to park in the pit. Where do you park now?
Most of the time, I'm able to get like the last spot in the pit. But if I don't, then I'm winding up. Sometimes I get into Pepper Canyon, but most of the time I wind up
So
across the street from.
would it, and just kind of going back to what we were talking about a little bit, would a mobile app help you to be able to say there are no spots in the pit, so you're not going to drive down there to begin with?
Yeah, it would save me 3 or 4 minutes to not drive down to the bottom of the pit to find out that there's no spots.
And would that help your day so you weren't frustrated?
Well, it's really not going to help. I mean, it's going to help my frustration, sure, but it's not going to help my ultimate problem, which
Right.
is it's still going to take me 20 minutes to get to my office, and I'm going to have to leave 20 minutes early to
Right.
get back, because if I'm not in my car at 5:05, I'm not going to get to daycare by 6 to pick her
Right,
up.
right. And I think part of the other side of that, and you know, we have daycare on campus.
Yeah, for $900 and something a month. And it's, yeah, well, and it's not for school age kids, it's for
Yeah,
little kids.
yeah.
She
So-
actually went to the International Center once.
The long-term impact of being able to identify for people where they can park might actually open up some of those places where people are going because they think this is the next closest, and we can identify where closer parking lots are for people and kind of help people know where to park from the beginning. So in the pit, I think a lot of people funnel into there because it's kind of a trained path where they thought this is always a place where I've been able to park. Then part of the parking went away, and we still have people that's their first stop, even though it may not be the closest place to where they want to go. And so using that technology, we can help show them lots that might be closer, and we'll be able to move people into areas, hopefully, closer to where they need to be, instead of them going to the next, what they visualize as closer lot. So it's going to take a little bit of time, but I'm hopeful that we can get that improved. The pit is one of the areas that's been identified as another parking structure, but I don't see the long-term funding available for that right now. The other one is that when the LRT comes on, the light rail, we're looking at having 2 stops on campus. One is on the far side over by Purse School, and the other is over close to Gilman. And what we're trying to see is if there's a way that we can make it so that when people are parking on the one side of campus, they can get on that and use it as the shuttle that comes across, because it would be a nonstop direct shot. And that way it would increase that ability to get to where you need a little bit quicker, because there's not the stops all along the way or the traffic that is on the streets that mixes in with that. Right now we're looking at 2018.
2018, right, so construction 2015 and completion 2018, late 2018.
Yeah.
And Sandag has made that project their highest priority project in the region. And we got a lot of good things going for it. Yeah, we've been planning for decades, but at this point, more than half of the project is actually funded because it's a Transnet tax that we've already been paying, 0.5% sales tax. And they've been working with the FTAs, the Federal Transit Administration. They rated it the highest project in the nation, I believe. So there's a lot of commitment to it, and from the regional point of view, it's a very strong commitment. So they're trying to figure out how to get it here quicker. Obviously, there's a lot of things involved in getting that, but we've been working with them for the past several years, and we know where the stations are, we know where the alignment is. It's now just about getting it done and getting it constructed. So that's another one of the challenges we had. So we
Right.
can't, in the face of that, we can't start overbuilding parking on campus. Number one, we don't have the financial
ability.
to do it. Secondly, once we do that, then we have the trolley come, which we think will have a significant impact on permits. We saw what happened at San Diego State when they opened that station. Somewhere around 3,000 permits were turned in the next day. They had empty parking structures, so that's not a smart thing. So we got to think further out. But we realize that there's a constant issue just with location of parking and where it is. But a lot of these things should help.
Yeah.
When we get kind of past those humps and figure out how this works, and how efficiently can we work these together.
So I tease Robert a little bit about taking up our parking spots. Yeah. It's not his fault. It's the campus's design to use those parking lots for new structures. And what we need to make sure is that not only are we making sure people understand that those new structures are great for the campus, but there's an impact because of the number of people that are here. What we need to be able to also look at is if the LRT comes, when the LRT comes, how does that change the traffic parking? Yeah, how does that change the patterns on campus? And right now we have about a $5 million a year debt service on the current parking structures. If we add parking structures, it's about $1 million a year in debt service. So we need to make sure that we're very conscious of that cost and the impact of the LRT. But that doesn't mean we shouldn't look at other ways to improve the situation on campus. And that's what we're trying to do, is make sure that we get enough feedback so we can focus on the areas that kind of make that bridge between where we're going to be when the LRT gets here and where we are currently, and really improve that service overall. Make sense? Okay. Yes?
I missed the first half hour here, so pardon me if you're repeating this. So I know you're addressing employees and students getting to where they need to go. I work with a lot of patients that just get really frustrated about the cost.
Uh-huh.
Also, when they're in the hospital for family members to come visit, it really adds up quickly. Is there any plan to subsidize parking for patients in the future?
Well, I can kind of direct you back to Ray, and he might be able to touch on some of that. We're not going to be able to subsidize the parking. There have been some of the hospitals and some of the medical centers that have done some subsidies. The caution is that when we start doing some of that, like validation of parking, is making sure it's used by the right people. And we have had some incidences in the past where we've had validation that has been used by people who are staff. And so they're utilizing that validation that was intended for patients with other opportunities to discount their own parking. So
That might have been, I don't know what the numbers are, but we're talking a lot of patients.
yeah. So our plan is to change the model of the way that we're doing parking. And our first opportunity was the Montecito lot, if you're familiar with the Montecito lot. It's a new lot down at Hillcrest, okay? And it's patient focused. And it was supposed to open in December. There's been a lot of construction delays in it. We're hoping to have it online this week, next week?
Online, then May 1st.
Okay. So what we changed is the program so it's pay on exit, so that people aren't overpaying for their stay, right? So when they come in, not only are they not overpaying up front because they don't know how long they're going to be there, but they're not underpaying and getting ticketed because their appointment ran long. We're trying to look at the model of let's make it so that it's real time and focused on actual use and not focused on a guesstimated use. Because I've been to the doctors before. I know the doctors get busy. You plan a stay for 2 hours, and the next thing you know, you're going in for some other tests, and 3 hours later you get out. It's not a good thing for us to be able to say, just because you were there longer, you're going to get ticketed. It's a better thing for us to say, we know that that's an opportunity. You might get out in an hour, and you're only going to have to pay for that hour, or you might be here for 3 hours, and you're not going to get ticketed because you're going to pay on exit, and you're not going to pay for that time that you weren't here.
Okay, so what I'm hearing is there's no plan to ever have so patients can come here and get validated parking. That's what I'm hearing, right?
There have been some validation programs. Ray, do you want to?
There are a couple that are very, very limited. And they've done things like extend some, I hate to call them free parking, but there's some temporary parking spaces so people can run in and get their labs or get their prescriptions on a very, very limited basis. But that's probably going to be the extent of it.
Yeah. On the pay on exit, there is a short-term turnaround where,
30 minutes, yeah. 30 minutes, right?
Yeah.
30 minutes.
30,
yeah. So,
Yeah, it takes most of them longer to get in, get what they need.
Yeah.
It's not very helpful.
yeah,
The validations that we really if the department asks, I mean, there's 16, I believe, right now, Jim? 16 that are validated in the cancer center all across the street over here at 751 to the entrance. So there's 16 different departments that do the validations.
Yeah.
So, kind of to answer your question, we hear what you're saying, I understand what you're saying. If we validate it, then that's something that each department has to bear.
Yeah,
And
okay.
I'm sure you know, departments don't necessarily have the funds within their budget to be able to do that. As a hospital or as an institution itself, I don't know that that's something that we're gonna move towards. I think right now we're focusing on ease, to ease the concerns, get them in, get them out. You know, pay on exit's first step. And let's kind of settle down there and see where we can go from there. But I know exactly what you're talking about. You have a family member who's in ICU and in there for, 3 weeks, it can get costly.
yeah.
Right, because
You get
people,
very,
you
very
know, they have
costly.
a couple, yeah, it's really, it detracts from coming to UCSD,
Yeah.
the patient, and then also working with the patients, and I see their frustration and upset.
Yeah. One of our concerns is how can we reduce that frustration? And that's where we started the first step of working on trying to design pay on exit, because I've been down at Arbor, I've been down at some of the other lots. When people come to me and they say, I couldn't get here any sooner, or there's a communication issue and they're getting a ticket before we're able even to upload that they paid. So we're trying to make it a more continuous effort so that they're really not going to have that added stress level. And the more feedback we get, the more we can work on designing the program. And one of the things that I heard from you today, which is something that I hadn't heard before, is the possibility of even looking at, all right, so we have a family member that's kind of having an extended stay. Maybe there's a pass that we can develop so that they can purchase a pass for a certain term of time instead of paying that daily rate.
Well, what they've been doing was giving people the OU permits
Mm-hmm.
to try to bring down that price, to reduce the price that they pay. I don't know that that's going to still be the answer. I'm not sure if you're familiar with the OU permits, but that was one thing they
Right.
started doing.
So the OU permits are an occasional use permit, and we do sell them. What we're trying to do is make them into a code so that we're trying to put things online so it'll be easier for people, and that way they can go online, they could purchase that code, and then they'd be able to go to one of the pay stations and just put in that code, and that way they'd be able to get that less expensive cost per day space. So,
Yeah, I know, like Children's in LA, you can buy like a 72-hour pass so that family members can go in and out, because that's another thing, every time you go in and out, it's really costly.
Yeah.
Let alone if you have more than one car, family members.
yeah. So that's a good point, and I'll task some people to look into that a little bit more.
And then is this department, from what I looked at, you're running on a deficit, is that correct?
Right, 2.1 million this year.
So how do you justify the whole running of this when it just is going on a deficit?
Yeah. So the majority of our deficit is actually focused on services that we provide that we don't charge for. Okay? So the majority of the costs come between the MTS that we provide, what is qualified as the free bus zone, which is truly a subsidized bus zone. This year alone, that's going to cost the department $3 million a year. We shouldn't be paying for that. That's something that should have either initially been set up so that people were paying for it or subsidized through the campus as a whole, right? It's a great sustainability effort and not one that I want to do away with, but it's not one that the department itself can pay for. There's no funding that comes into it, and as an auxiliary operation, parking is an auxiliary, which means they have to pay for, it's a pay-for-use service, right? So by the UCOP rules, we're supposed to be charging for the services we provide to pay for that cost, but the way that it was set up and done didn't do that. Now in 2006, it was $300,000 a year to provide that bus zone. It has grown so much that we had 2.5 million riders last year, and the cost this year is expected to exceed $3 million a year. We need to be able to address that either by getting people to purchase the passes or getting the university to say, this is a core substance for the campus to work with, It's a sustainability effort that we want to make sure that we provide for and find a funding source to provide for that. So that $3 million a year puts a huge shift in our whole program. We're not losing money if we're not paying for a program that we're not receiving any funding for. The other piece of that is the shuttles that we run. Now, I see the shuttles as being a core part of our service because we're trying to provide access from the lots to where people are. But that service should be internal to the campus, from campus point to campus point. We run one right now out into the city. That's costing us about $1.5 million a year. We shouldn't be going there. Not only is it a financial burden, but we actually have had significant issues by driving out into that area and hitting vehicles out in that area. And earlier this year, we actually had somebody that was hit by one of our buses. So, we had an actual pedestrian that was hit by one of the buses. Our liability for being out and duplicating where MTS is running is extremely high. It's not a place where we should be. We should be running campus point to campus point with a campus shuttle. So if we look at how we control some of those costs and bring it back in line, then we don't have to look at some of the other issues that we have. And one of the things that I would tell you is that we have not focused enough on technology in the past to bring us current. Yeah. So we've been talking with a lot of companies about what should we be doing and what are other campuses doing, and little things like putting sensors in parking lots so that we can give real-time estimates of what parking is available, connecting that to handheld apps so that people know, if I'm going to the Morris Cancer Center, where's the closest parking lot and what's open and available. That's where we want to get to. We've been focused too much on, the deficit spending and how do we control that we haven't been able to look at the long-term, where should we be? And I'm trying to take our team and say, let's not look at today and where we are. We'll work on fixing that component of the loss and trying to get that realigned. But let's also focus on where we need to be, because by controlling the lots better and providing better service, we reduce the frustration on the people that are coming to campus. We can increase the time that they spend on campus and not driving around looking for a parking spot. We make the campus friendlier because it's more accessible for people when they come in. And the cost actually that we pay up front for putting in those services will probably be balanced out by the reduction in pain that people feel by having to go around and search for that. The time lost for the people that are searching for parking is not a good model. We need to be able to reduce that. You're welcome. Any other questions? You just came in.
I took public transportation.
Huh?
4 201 buses, or 202 buses went around before they picked up at the stop. So just to show you how full and what the demand for transportation actually is.
Yeah, and that's one of the MTS buses?
Yeah.
Right. We've been trying to work with them to know what our traffic models are so that they can work on that. If they're over and you're waiting for 2 stops, we should have people that are responding to that. They should be calling in. Are they flipper buses?
They're supposed to have a bus on call for that situation.
Yeah, well, there were 4 went by and we actually caught the 150 instead.
You might want to just reach out to Mark and let him know.
They do regularly.
Yeah. Yeah. So he's got a really good connection over with MTS, and when we get that feedback, that's an important thing for us because we can help MTS know when they need to contact their drivers, for one, who should be calling back for those flipper buses, and 2, so that they get better feel and rapport with the community that's using their services, right? That bus is supported by additional buses that can be brought on. Their drivers are supposed to be contacting those buses so that they get those added support lines in place to relieve that.
Yeah, it's a daily occurrence. So whatever system that you think is in play is clearly pretty well broken.
Well, it's outside of our control because it's MTS, but we do have connections that we will bring it up to them because they've told us that they do have the support mechanisms in place. We can follow up by having some of our people kind of watch that too, because we need to have that good partnership of the community, the campus, and the public transportation network, because that public transportation network helps reduce the impact on campus. Okay? Yes?
Yeah, sorry, I came in late as well, but I was kind of curious, is there any conclusion as to the Nobel and Amoeba shuttle being ceased to exist, I guess?
There isn't a conclusion to it yet.
Will there be, and when will that be?
That's a good question. It's one where I've been waiting to meet with the Vice Chancellor to go over some of the finalizations of some of this stuff. But one of the things that we want to do before we finalize anything is make sure that we get feedback from every group. And this meeting actually got postponed a couple of times. We wanted to make sure that we could reach out to the health services before we start putting out other information. We want to make sure we have a more balanced approach to having everybody's feedback. And the opportunities are what we're looking at, is how can we make sure that everybody has those opportunities. And you work for our operations, so you know some of the concerns we have. What we want to make sure is that what we do supports the campus. So even when we talk about eliminating that route, we're also talking about making sure that we have the availability to backfill until MTS can support that. Right now, even if we were to say that we were going to eliminate it in July, for example, we wouldn't be eliminating it prior to probably the end of the fall semester, because we'd want to make sure that we had that support till MTS could bring up their services. And the bigger challenge for us is making sure that we had the conversations with MTS, and some of the MTS people are very supportive, and some of them are very dollar-driven, right? And the very dollar-driven ones were telling us that's a service that UCSD has to provide. And I asked the question, why? Because we're going out into the campus community. We're going out beyond our borders into the city to provide that service. Now, if we're going to do that, the way that we're structured right now, we can't charge for it. If we change our structure so we can charge for it, which changes us from a campus shuttle service to a transportation service, right? Then if we're going to change that model, we're going to be under a lot more scrutiny. We're going to be under more inspections. We're going to have more training time that we need to provide. It's not something that's been explored in the past, but if we're required to go out and do that and start charging for that service, then I'm going to go back to Sandag and say, if we're now going to be a transportation authority, which is what MTS is, then shouldn't we be getting part of the funding that you're providing for MTS to provide this traffic mitigation service, right? So we're not trying to get into their pool and do what they're doing. We're trying to make sure that we understand where the lines are and protect the university from getting into some of the liability issues that we have, and then provide the services so we can better focus the campus to the campus needs. We want to make sure we provide the support. We're kind of hopeful that we can do that through the external support network and making sure that we can help bring them up to the level that they need to be, rather than us going outside our borders and changing the whole program that we have.
Thank you.
You're welcome. You've been very quiet in the back. Go ahead.
Yeah, this is a lot more complex than I had ever taken the time to learn about. So I'm just grateful that there's a shuttle from Hillcrest to Thornton, because I take that shuttle every day and to get to work and to get home. But it's just so complex with the finances, the liability, all of that, and I'm learning a lot. But I've always had this question, because I don't understand all of this. I've always had the question, why are buses always bigger and bigger? And I remember when I was in high school in Mexico, they would have a 16-passenger van, and they ran so frequently. It was every 10 minutes, and it would fill up quickly, take off, and there would be another one in 10 minutes. There was no waiting, really. If I missed that one, I knew there was one right behind it, and it was very efficient except for wheelchairs and bicycles. But here, every time I see a new bus, it's always so much bigger and never smaller, and I'm just wondering why never smaller and more frequent.
Okay, that's because the cost of running the shuttles is much higher when we run smaller buses, right? So I can operate that small bus at almost the same cost as I can that larger bus, but I can service more people with that larger bus than I can with that smaller bus. So if I add 2 buses, which probably would be 3 buses to cover what one of our larger shuttle buses would cover, our costs go up about 2.5, almost 3 times. So when we're looking at how we control costs and provide services, the bigger bus is how you make sure that you can provide for a larger group of people without increasing your costs exponentially.
Have you looked into contracting with private companies that might provide the service more efficiently, like that, smaller?
I can't say that they have in the past. I can tell you that everything's on the table for looking at how we can provide services. We do want to make sure that we're careful not to impact the union people that we have working for us. So we have some issues that we have to make sure that we pay attention to along those lines too. But there may be some room for that. It's not that I'm against looking at privatization. I've done privatization when I came from the campus I was at, but what I did make sure was that everybody who worked for me before found positions before we'd made the transition. So, you know, it's making sure that we're treating the people that we have working for us correctly, along with being able to provide that privatized service. Sometimes the privatized service makes sense and sometimes it doesn't, and you have to be able to weigh the cost and the impact. Sometimes it's assumed that there's a savings by doing that, but then you start running into the longer term issues of them coming back and saying, well, we've contracted to do service between these hours and these hours, but it's really slack during this period of time and it's costing us too much money, so we don't want to provide service during that time. They still want to charge you the same amount, but they want to drop the services. And that's one of the issues when you're working with a contractor, that you need to make sure that you can maintain the level of services that you have. So it's not that we won't look at that. We have to look at everything because we have to be able to get to a sustainable model for the financial piece. We want to be able to get to a sustainable transportation mode so that everybody has that access. Longer term, I think that the piece going between Hillcrest and campus here, we may be able to go to a smaller shuttle that goes up and down to the Old Town Station and maybe pick up the LRT at that point for people going back and forth to the campus instead of right now. The LRT is where people come to Hillcrest. So they're boarding the bus and coming up to Hillcrest and then coming across. We may have to look at that bridging of the LRT being the route that goes from Hillcrest to the main campus and just doing a short shuttle route up and down the hill back and forth to that, which would increase the number of times that they could actually do that. So, yes?
I've also wondered about science being in languages other than English, because I've been to many other hospitals and seen what they do, how they have their science in English, in Spanish, and in other languages as well. I know now that you're talking about costs, that's very expensive, but
Expensive but important. And I would tell you that one of the committees that I've gotten on since I came to campus is a wayfinding committee. Because when I came to campus, the very first thing I noticed is that you can't find anything, right? If you know where things are, you can find them just fine. But if you're coming from the outside, which many of the people visiting the hospital are, they don't know where things are. So we've done a really good job of making these waypoints that blend into the background, that people who are on campus know where they're going, know exactly where they are, but the people who don't know where they are don't have the ability to see that. Putting it in different languages, I think, is probably an important aspect, especially when we're located so far south. We are impacted by having multiple languages. Our campus is really fairly universal in the different languages that you hear as you walk around campus. I can bring that up to Kim Kennedy. Kim and I are working on a project right now for wayfinding, and I know there's some proposals out there right now. I was in a meeting on Thursday. I had to do it telephonically, so I couldn't actually see the presentation. I'm hoping to see the presentation on Wednesday, but that is an important piece, is not just the different languages, but even just having proper signage to make sure that people know where to go. So, thank you. Other questions?
I just have a comment.
Yeah.
I don't know how this will impact the Hillcrest shuttle, but I ride the 150. I live in Point Loma, so it's just boom. But I have more than a handful of co-bus riders that when July comes up and they're going to be charged the $40 or whatever it's going to be, 'cause obviously the free bus pass will go away. They are going to ride the Hillcrest shuttle from Thornton to Gilman and Myers, to Hillcrest, and then back to Old Town to avoid that $40 a month. Myself, I just pay the $40 a month, I want to get home for a glass of wine. These people are like, they don't care about the extra half hour, and I think that's going to push up your ridership on the Hillcrest shuttle so that they can avoid the $40 a month bus pass.
It's one of the things that we've looked at is elasticity of ridership, and one of the things that is the unknown is how many people will actually do that. There's a lot of talk about the way people will change their patterns based on being charged for it. Reality is that there'll be an uptick in some of that, and the inconvenience factor becomes more of an impact than they had thought. And so there will be some people that will change their patterns, and there'll be a significant number that won't. The other impact that people talk about is, I'm going to drive instead of ride the shuttle, instead of riding the buses because you're going to charge me. Well, there's a cost to that too. And part of the cost that people don't look at is not just your travel time, which is an important one, but the fuel cost, the insurance cost, the wear and tear on the vehicle, ownership of the vehicle, not just parking here, but parking wherever you would have to be parking on the other end as well. So there is a concern that we have done some elasticity work with to try and see what that impact is. Part of the reason where we were looking at summer for transitioning is because we can absorb some of that impact, and then people can kind of start to stabilize, and then we get the next bubble when the students come back in September, sorry. And what we're looking at is that a lot of the students that come back, we're looking at people that haven't been here before. So whether they're transfer students or freshmen, they don't have those same patterns built, so they get to build patterns at that time. So that's kind of why we're trying to do it. It's kind of like doing a phased-in approach. If we work on doing things in the summer, we're essentially being able to do a phased-in approach because that's our low point in time. It's not our time when we're at our highest traffic points. So it will have an impact. It will allow us to do some adjustments along that way. The overall picture is we won't really know what will happen until it happens, and then we'll adjust. So one of the things I want to make sure that people understand is that we also want to be fluid, and I don't think that anybody's really thought about that too well in the past. We need to be able not just to say, this is what we need to do, but be able to measure it, look at it, and change if needed. So we can't be static. Universities are horrible for how long it takes to get anything done. I can say that because I've been in education for 29 years, so I've seen it. And when we go through the processes, we think everything needs to take 2+ years to do something. And in private industry, it's done, right? I've also owned businesses. I've been in private industry. We need to be more reactive and responsive. Trying to be proactive instead of reactive is what we really need to focus on, but we can't wait 2 years to make changes because that 2-year change process just really kills us. I'm frustrated because the Montecito lot that's down at Hillcrest was supposed to be open. The delays that we had were because of rain. I come from a place where we have a situation where you have 3 months in the summer to build something and you're done, right? Because then the ground's frozen and that's it. Rain doesn't stop people, and it baffles me to see how rain can stop people working on a parking lot. So, we need to get past some of the traditional ways, and I know change is difficult, but incremental changes help us to be able to get to that next step. And what I want to be able to see us do is get from one level to the next level and continuously move up. I look at this as not parking services here, transportation services under an umbrella, working together for change, but also under my umbrella, which is auxiliaries, all of the people in our department should be working together to look at how we can improve the services on campus. But the real point is we are part of the campus, and we need to be able to work under an umbrella that says, this is the goal of the campus, how can we make things better as a whole? So that's really what my goal is to make us look more globally at what we need to be and not in a siloed approach of what we're doing here and not being able to break out and help people understand. We want to be transparent. That's why we're holding the meetings. That's why we have put stuff up on the web. That's why I go out and talk to groups all the time, because we want people to know not only what our challenges are, but to get their feedback on how we can provide better services. So that's really my goal. And I know my team's been good at that. They've been looking at it. Sometimes they ask me questions like, what do you mean we can't do that? And I say, well, let's figure out how we can do this. Or they look at me and they go, Robert? And I say, I know.